in this panel, we started chatting yesterday with a group of individuals. Jim was there, Bill was there as well. But there was so much to chat about. It clearly shows there's a lot of discussion to be had about a great many things around tinnitus. Um, but one question that I'd like to start off with, and we can kind of see where the conversation goes from there, is something I posed yesterday, which we didn't get a chance to get to, which was, non-FDA approved versus FDA approved solutions for tinnitus. And do we feel there's a role for both of those, right? So there are some, there is an FDA product out there that is approved, but a lot of the platforms we talked about today aren't necessarily FDA approved, but clearly do bring value to many people who are suffering from tinnitus, and they incorporate many of the peer-reviewed techniques that we know work, such as CBT, mindfulness, sound therapy, when done in conjunction with guidance. So, kind of just to open it up, do we feel there is a role for both FDA approved and non-FDA approved solutions that incorporate techniques that we do know work? Bill, you raised your hand, so you want to kick it off?
Yeah, I want to make the distinction between FDA approved or FDA accepted. Is that where you're
Or
going with
cleared. I
that?
think FDA cleared is the other term that they often use, right? So FDA cleared, I believe, means that a product is sort of adjacent to an existing product that's already out on the market. FDA approved, typically you're bringing something new to the market and you've got the data, the empirical evidence to show that it brings that particular value that you've defined. So there is a difference. However, that being said, there still aren't a lot of FDA cleared products either for tinnitus. But as someone who's worked on these projects before, I know these non-FDA approved platforms do bring value to people, especially when tied into professional services. So just to open it up, what is everybody's thoughts on the role of both of those channels of products?
Maybe I can say a word in
Yeah,
the
please,
context of
Bruce.
digital therapeutics, and then probably it's really important to have a distinction between evidence-based and FDA approved. So, like a treatment can be evidence-based, meaning that has been validated through research, but does some treatment don't need to be regulated. And for example, this changed from country to country. So it's interesting to look in the wellness product, or depending to the claim. So it's often linked to the claim of a product. If a product is modifying or claim to modify the pitch, or modify the loudness, or modify the perception of the tinnitus, often then it's going to become like a medical device, and then it will need to be regulated. If an app, for example, in the case of what we developed, it's a wellness product in the sense that it's using evidence-based technique, but the claim is not to change the tinnitus, and then the claim is about changing the reaction to the sound you hear. So here, we are not going to sort of we and it's where it's a lot about what you are claiming on the products that you use, and it means that there's certain case where you can get an evidence-based product, but which doesn't need to be regulated, and means doesn't need to go through the FDA or the TGA, like for example in Australia, which is the equivalent. So it's quite interesting and quite important to make the distinction between FDA versus evidence-based, I think. Yeah, but happy to hear other points also.
Yeah, I think you bring up a really good point, Fabrice, in terms of pointing out how important evidence-based practices are. It's all about claims, right? And we know that tinnitus can be addressed from this holistic wellness point of view, that we can do things in our lives, as many of you talked about over the last 2 days, that don't necessarily have to do with audio related behaviors, but things like, eating well, exercising, socializing, find the things you enjoy in life, getting good sleep, and tools that help you improve those aspects of life, inevitably can also benefit those people with tinnitus. So I think you bring up a really, really interesting point. And I think it's also important that you bring up, it does change from country to country. So depending on where you are in the world, understanding those types of things. And the other thing I think is really important is when you talk about evidence-based, because in the consumer side of things, there are a lot of scams and hoaxes out there, right? That's the reality. We don't talk about it very often, especially in audiology curriculums. But there are a lot of scams and hoaxes out there that are not evidence-based. Certain pills that say, you can take your tinnitus away in a couple of weeks, versus proven techniques like CBT and sound therapy. So I think that's a really important distinction that you made there, Fabrice. Does anybody else have any thoughts, any comments on the role of those two different types of solutions?
Did you see Le Guin's question in the chat?
Let me take a look here. Correct. Yes. So we're referring to devices. That is correct. So not things like CBT or mindfulness, correct, but it would be a product that might incorporate some of those things. So good question. Good question.
And Michael, I would maybe just add, maybe it's not clear, it wasn't clear to me, and I will interchange the words often myself, but it's my understanding that it would be an FDA cleared product if it's a medical device versus it would be FDA approved if it's a pharmaceutical. So I think those are two distinctions as well that I think even in consumers don't necessarily fully understand. And
Correct.
at the end of the day, it's still FDA played a part in it, but those are the two words. So you'll never see technically an FDA approved medical device because they in fact clear it.
Yeah. Good distinction. I think you're right. I don't think the average consumer does necessarily know the distinction between those two. So that's important. On that note, we talked a little bit yesterday about, big tech groups coming in. Obviously with the introduction of things like, Apple's AirPods 2 Pro 2 coming out with the ability to turn it into an OTC and take a clinically validated hearing test. What are your guys' thoughts on big tech and their influence, maybe in the auditory health space in terms of awareness and public education, and maybe even more specifically down the road in tinnitus? Do you think there's a collaboration there between the audiology industry and big tech? Do you think these kind of introductions will help bring awareness to the general public?
There is no question about it. And here you have a brand like Apple, which is consumer facing, and they have loyal customers, and they have had customers for over 20, 30 years. One of the things that Apple was so smart about is let them invest in children in education, because one day they're going to have that purchasing power. Well, they are already here with that purchasing power, and they're going to have their own health issue. So with their own health issue, where do they turn to? Something that they love and dear and are familiar with, and that's Apple product. So having an iPhone, an iPad, or Mac, or even the AirPods for that matter, along with the health app, and something that we're all very aware of, which I'm going to speak about tomorrow, is the noise app that Apple has. And it works. You're being informed, and if it's going to help broaden awareness, why not? One of the things that we've learned with medical companies is they're dealing directly to the medical community, not so much the general public. So if you have a well-known brand like Apple, but deal with the consumer directly, why not? Put it out there.
Yeah. Clearly Apple's making a leap towards auditory health in some capacity, and what that looks like in a few years, I guess we'll all find out. Anybody else's thoughts? One thing I think of, like Fabrice, with the Mind Ear app and some of the other apps that are out there, you could stream a lot of the exercises, the audio exercises and sound files directly to any type of earbud or headphone, correct?
Yeah. So there's no limitation there. That's interesting also in this space to look at what has been because let's take sleep, for example. Apple has been so they introduced a sleep like program or like monitoring, helping you to monitor sleep. And it's interesting that they are willing to sort of like, and potentially it's like we have a little bit, I think they introduced a sleep program maybe 3, 4, 5 years ago. Now times fly, so maybe it's longer ago. But it's quite interesting to see the different or parallel areas and try to see how they are tackling it. So I don't think their aim is to develop a sleeping program, for example, but they have an introduction and they have some tools and they have like the health app or the health hub is potentially a place that might have a bigger importance in the future in our health. So like, so yeah, I think it's challenging to predict the future.
Sure. If we could do that, we'd all be rich and developing more products, right?
It's definitely an interesting, and I think it brings awareness, which is important, and so like it's probably the first things. And it doesn't think I think it's like creating awareness is helpful for any audiologist, for sure, to sort of like it makes that more people are going to talk about hearing.
Absolutely.
Well, Fabrice, I mean, when the Apple Watch first came out and everybody was talking about standing, like you need to stand up, who honestly would say, "Oh, I know about the issues about standing, that we should stand up," before the Apple Watch came out? I did.
Changes behavior. Yeah.
And so once
Powerful.
they alert you, hey, you need to stand up. And thought, okay, it became a pet, it became a new thing, but now it's in your brain, it's in your head. Oh, you know what? After 10 minutes, 15 minutes, I should stand up. So if you can instill that little bit of a good, healthy habit, it goes a long way.
It can. Yeah. It's a really good point. And we had a talk today about using biometrics in conjunction with some of the more conventional tinnitus practices that we know. What is everybody's thoughts on kind of the future of biometric use as we move forward with tinnitus management?
I'll comment. Hi guys,
please,
this is
Ben.
Ben Thompson here.
Yeah.
Great to see everyone and be here with you guys. I've been thinking about this, and on one hand, that sounds exciting and helpful. On the other hand, it could be putting the attention on tinnitus in a way we don't want and is not beneficial. So, for example, amongst all of the professionals and researchers and experts I've spoken with, the consensus seems to be do not have a tinnitus journal. Don't be tracking everything about your tinnitus. Do what you can to promote habituation, which means bring it out of the conscious mind and more into the background. So yeah, curious what you guys have to think about that, because I know friends who have the Oura Ring and who have the Whoop and who have, all these trackers. The software is so good, they can always track it. And if you're tracking the stock market every day, you get stressed about it.
Right.
But if you just set it and forget
you
it,
react to every little move. Yep.
It's maybe healthier. So those are my initial thoughts, but I'm open-minded to it.
Yeah. Yeah. Anybody else's thoughts?
Panel discussion. It's very interesting.
No hurry. Quick question.
Thank you.
I can agree with you, Ben. We know there's psychosocial benefits of wearing lyric, and one of the hypotheses around that is because the patient isn't reminded that they have a hearing loss or maybe tinnitus, if that's what they're using it for. They're not reminded every day by having to put the hearing aid in and take it out or put it in the charger, because they wake up hearing, they just go live their life without being reminded that they have this loss. And so I think in that same way, to your point, Ben, I think that same aspect can apply to tinnitus, where that not reminding them about that can actually be beneficial.
Yeah, I think you guys bring up some really interesting points. It leads to the really kind of to the forward thinking mindset of it's about how you build it. It's about how you incorporate it, right? Just bringing biometrics to the table alone isn't probably going to move the needle all that much. But if you collectively package it right and it's delivered to the user in some seamless way, to your point, Ben, that's not reminding them it's tinnitus time 6 times a day, but some way build it to work and promote habituation, then I think there's some value to that, right? What that design looks like is a bigger question. That's $1 million question. we can have another panel discussion for that, and we can all start a business together. Fabrice, do you have something you want to add?
And I think it's like as long as it's promoting healthy behavior and like to the point of journaling, we and I completely agree with Ben that we don't want people to journal, but we might be able to sort of promote gratitude journaling in the sense that as long as there is like so as long as the instructions are correct and then we set people in the right direction. Then it might be some very positive benefit, and same with tracking device for sleep. If we basically stress out on the fact on checking our sleep, might not be very useful, but there might be like a use case where it might be very useful, I think, for the population. So it's all about how we use it and the context and how it's been like how the person has been coached to use it properly, probably. So it's interesting. I think like it's opening new avenues, interesting avenues, but it's hard to use it properly and give the right instruction probably.
Yeah, the other interesting angle I think it could be helpful for down the road is uses in an indicator for the next referral, right? If someone has this data and we see that a primary problem they have is sleep quality or their heart rate is elevated. Of course, as audiologists, it's not our job to treat those things, but it could give us some information that we may not have had prior to, unless we have some type of intake form that answers these questions. Very few people do. Maybe not so much about sleep, but it could give us some indicators on where to guide that person, because we've had some discussions over the last 2 days that tinnitus management isn't just about audiology, right? There's a number of professions that could play a helpful role in all of this. What are your guys' thoughts on that as it giving us some indicating information to refer on to other specialists that can assist us in this, tinnitus management program for an individual?
Michael, I see a new opportunity for this health advocate, the personal health advocate who can go in and assess your overall biometric and break it down by, auditory, hearing, tinnitus, noise. You have that part of it, and then there might be data collected related to your heart, etc. So what would be really interesting is for someone to go in and say, hey, you have all this information, it's pinpointing to something. Are you doing something that could be harming you? Or is there just something very interesting about your pattern, something about what you're doing? And I think that's the next thing. I think it's happening in
Very
the
personalized
world of mobility
Yeah.
and digital mobility.
Yeah. Yeah. Any other thoughts? Any other comments?
We
Jim,
did a
please.
study many years ago on ecological momentary assessment, and we published it, and we basically asked tinnitus questions multiple times a day for I can't remember how long, weeks, and it's really interesting to see how people's perception of their tinnitus varies within and between days. And you can't get that information by just administering a questionnaire at one point in time. So I think there is value in capturing this real-time information. And we did assess, were they more bothered by their tinnitus at the end of this procedure as a result of answering questions about tinnitus multiple times a day, and they really weren't. So I think maybe some people would be, they're reminded of it and it bothers them more, but from our data, we did not see that. So it may be argued both ways. I think it's an interesting concept. I don't really view that as therapy, but it's looking at outcomes, and it's looking at outcomes in a unique way that you can't get any other way than to do it multiple times a day for days and weeks at a time.
Yeah. I mean, I guess it's like most of us, right? Some people like having notification banners pop up. Some of us don't, right? And you can go into your settings and set that as a preference. Well, as we talk about, biometrics, we talk about some of the different apps, and some of the other solutions that were discussed today. You know, one of the things about hearing aids is it's an expensive buy-in, right? For most people. It's an expensive product tied in, and most people, and that's kind of why OTC was introduced in hope to kind of lower the average age, lower the price point of entry. With tinnitus, how can we kind of ensure that it doesn't fall into the same trap of only being a service that is for the people that can afford it, and we make it more accessible and more affordable to people as time goes on? We know that based on the WHO estimates, in the next 20, 25 years, the people with auditory health issues in whatever capacity is going to like double, triple. How do we think about bringing these types of services and solutions to people across the board, that so that everybody can afford it? Because not only people that have a lot of money experience tinnitus, right?
The question I have is, where is our success on treating tinnitus for the general population? Not
Sure.
that problematic, troubling 2%, where where is our success in treating general tinnitus manageable cases? And
Yeah.
then ask yourself, what are the learning from that where we could start to go forward and deal with the increase in population with those troubles?
Yeah, I think that's great. I think a couple of you guys can speak to the numbers here. Like when we look at the population that experiences tinnitus, not everybody experiences tinnitus the same way. Not everyone has it to the same distress. What percentage of the population has really distressing tinnitus versus people that might have some sound from time to time, but it's not necessarily something that's disruptive on a daily basis? Anybody have those numbers off the top of their head?
Yeah, 10% of the population has bothersome tinnitus. 1% of the population has moderate to severely bothersome tinnitus, from my understanding. So yeah, about 3 million people are significantly affected by tinnitus, as I remember.
Yeah. I mean, so that's a pretty decent chunk. I mean, do we all kind of agree with those numbers? Is that roughly? I think I've seen the same data, right? About that 10 to 15%
Yeah,
overall
yeah,
population.
that's the numbers we've always used. About 10 to 15% of all adults experience chronic tinnitus, and of those, about 20% are significantly bothered by it.
So Jim, you talk a lot about this, right? The different categories of tinnitus. Can you spend a little time kind of talking through what's the big distinction between those groups?
Um, Well, you got your bothersome versus non-bothersome. Is that what you're talking about?
Yeah, in general
And
terms, yeah.
and it's really not one or the other. It's a continuum. I mean, how
Hmm.
bothered is a person by tinnitus? And there's many factors that play into that. And that's part of the evaluation of a patient is looking at those different factors. What kind of life are they living? Is it quiet? Is it noisy? Are they busy? Are they not busy? What kind of personality do they have? There's just so many things that play into this, and then they fall on this continuum somewhere of how bothered they are by their tinnitus. So that's the main concern is determining, are they bothered enough to really need treatment? So in terms of efficiency, you've got to evaluate their hearing. You've got to do a basic evaluation to determine if they need to be referred, and you need to determine how bothered they are by it. And if they are bothered, like I was saying in my step care talk earlier, the next step is education. They need to be educated so that they can make an informed decision about what they want to do, if they want treatment or not, and if so, which direction do they want to go.
Yeah, I think that you point out education, right? That's really the big
Yeah.
key. And I've Fabrice and I have done a lot of work together to try and promote that education, right? And it's challenging. How do we? I mean, you guys, a couple of you guys here have businesses, you promote tinnitus services and such. You know, how do we promote this education and create this awareness in the coming years?
I think ENT doctors is a really underrepresented part of this discussion because so often that is where people go when they have bothersome
Sure.
tinnitus, and that's kind of that's an important part of this. Um, so ENT doctors and audiologists on the front lines of doing that initial assessment, right? So if I have significant tinnitus and I book an appointment with a clinic that says they help people with tinnitus, I'm delaying my anxiety and stress until
Yeah.
that appointment.
Yeah.
At that appointment, I'm looking to get relief or clarity. So that's obviously one piece that relates to everyone who's listening or watching. Then there's, YouTube videos. I've made a lot of them on tinnitus. Then there's apps. I know Dr. Barty here, Fabrice has an application that can be used. So there's definitely digital components to this as well.
Then I have a question with the ENT, and they should be doing it. It's because, and I'm thinking like a businessman, it is not viable to their practice. It is not a viable piece of service that they can offer.
Or is
It
it a
doesn't
lack
fit
of
it.
education?
It's both. It's
Yeah.
both. The tinnitus patient who can't benefit from a medication or a surgery, as well as most ENT clinics or audiology ENT practices, aren't set up for the extensive counseling that most tinnitus treatments,
Mm-hmm. Mm-hmm.
undergo. Additionally, the doctors need to be trained in it- some educational component of here's tinnitus, here's how to communicate to your patients, here's what the next step should be. All those need to change for this to fundamentally change.
And potentially, it's like,
Bruce?
how do we make it interesting for the ENTs? It's like, because it's often not really at one of their priority. And then we can see, like in the conference, it's often that we see one ENT out of like it's very few who are really interested by the topic. But it's I think it's like we are all here trying to sort of like make a difference in order to get more people understanding the condition and how to treat this, and in different ways. And I think there's not one solution, is like the combination of everybody's effort which is going to make a difference. But it's true that if we could crack about how to make it interesting for ENT, I think that will make a huge difference for the life of so many people who basically get this bad experience. Because we get it all, like it's often when we talk to our patients that it's the first point where things went wrong. So, but
Yep.
how to make it interesting to ENT? Like, I tried to talk to quite a few, and I did not find yet an answer that could basically how to sensitize them in the process.
I do have a
Um,
quick response to that. I've had some
yeah, that
success with
would be
that.
great. Yeah, yeah,
Number one is efficiency on time. Number two is um, creating a positive experience for people that come to their clinic
yeah.
so that word of mouth marketing carries. And then also just doing the right thing. So if you don't offer anything for this patient, but there's someone that you trust who does, then you should do the right thing. Those are generally the value propositions for ENT doctors or busy clinics that don't have time to take care of tinnitus patients.
Oh, that's good. Yeah. And then other thing I heard also, like basically, if we could help them to basically avoid a second visit where they come back to their, like where the patient come back to them and with similar issues. And probably that was one of the things that TNT were telling me. If you are able to give me a solution for that, then I can basically spend more time with another patient. And yeah, so that's but how to promote that then at scale to make sure that we get this communication or this education time in order to basically give them access to the solution is probably another challenge.
Sure.
Uh,
But I think it,
Uh,
it 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 highlights something of importance that Ben mentioned. There's a lot of information these days on the different digital media channels, right? Whether it's YouTube and videos that you guys have created, whether it's Instagram posts, guiding people to websites that they can use to learn information and access services, or LinkedIn. Um, Unlike 5 years ago, there is a lot more information out there, and that's a big part to some of you guys on here right now. And in the chat here, the point of there are a lot more self-care options. So what you, Fabrice, and Ben talk about in terms of changing ENT behavior, I don't have to tell anybody the reality of how difficult of a lift that actually is. And then when you talk about numbers of 10% in the US alone, that's 40 million people who suffer it to some degree, right? So the numbers are quite massive. But I think it highlights that there is a lot of information out there, contrary to what many people think. And you guys are, in many ways, the front lines with the YouTube videos you're putting out, the different digital content that you're putting out, the services and the self-care options that you guys are putting out. So I do want our listeners to walk away realizing that the people that can help you are in this meeting right now and in this symposium over the last couple of days. So we highly recommend people to check out apps like Mind Ear, Resound Relief, even apps like Calm, and services like Treble Health, and products through PhoneX, product catalog and stuff. There are people out there that can help you, and there are lots of good information out there as well. So, Bill, please.
Michael, can I get that something? So you started out with the consumer question, and now we're at the ENT question. And a part of me was thinking, well, ENT, they can look in, they can see something that could be fixed, okay? Tinnitus can't be seen. It's hard. It can't be fixed right away. So I'm thinking of Wave, the app that mothers can use to see if their child had an ear infection, and it alerts them, because what you can do is use the iPhone with the cone to take a picture of the child's ear to see if there's an ear infection. And what the app will do is say, yes, it appears to be an ear infection. Please reach out to your physician. That is a powerful way of where you just bridge the relationship between the customer and the physician. And now you're saying, okay, what do we do to move forward on that?
Yeah. I mean, that's the trick. And I think a couple of the guys here can speak to, trying to make that bridge between ENT and the platform that you're offering. I think Ben gave us some nice bullet points of what the ENTs are looking for. You got to bring the value, right? It has to bring some value to what they're trying to accomplish as well. We're going to wrap up here in a couple minutes, and unlike last night, I don't want us to abruptly get caught off, so I'm going to come in with a smoother landing today. First of all, I want to thank everybody for joining us. I know for some of you, it's a little bit later or even very early in the morning, depending on where you're calling from. I want to thank everybody that's presented today. Everything went wonderful, and I really enjoyed all the presentations. I think it brings a lot of value to the community. But as we wrap up here, what's just one quick tip you'd offer our audience as we do our send off here? I'll just let everybody kind of chime in and give one quick tip that they can offer our audience to help them with their tinnitus and maybe just their overall auditory health.
I'll go first. I'll be quick.
Please do, Ben.
I would say for the audiologist listening, when you speak with a tinnitus patient, you don't really know how severe it is in most cases. Be optimistic, be confident, do as much as you can. You are the expert as far as they're concerned, and refer out for help if you're not comfortable with a certain severity.
Yeah, great. And if you're not confident, there's plenty of educational content out there to help you get to that point. Awesome. Fabrice?
I would say give up to your patient is probably you go a long way just with being able to be optimistic. Yeah.
Fabrice is the eternal optimist, no doubt about that. Jim?
Yeah, well, make sure they really have chronic tinnitus, determine if they need to be referred, and that would be secondary tinnitus usually, to ENT, and that's where ENT is important. And then they need their hearing evaluated because they probably have some degree of hearing loss, and they need to be educated. All those things need to be done, I think, with anybody who has tinnitus.
Absolutely. Michelle?
Yeah, I would agree with what everyone said. And I think just as an audiologist, being sure if it's something you're not really comfortable with, making sure you're comfortable to refer out and talking through that, because a hearing aid may be a solution for some, but for others, they might need something more or might need that help of other professionals too.
Nice. Bill, give us something quick.
Ask for permission, align with the person, and ask questions.
Love it. My advice, take care of yourself, be well, and I want to thank everybody. I hope to see you all tomorrow.